kind of a red circle, if you like. It's like the bullseye. So that's called the umbo. The umbo is the part of the hammer bone, also known as the malleus, that connects to the eardrum in its central position. And that previously wasn't visible, so that's now in sight. And truth be told, I'm happy at this stage. The patient felt as though they can hear back to normal again, but they were really still. I just decided to see if I can get a few more out. You can see the majority of the eardrum. This wet wax, matted wax, is more in the anterior recess. So in most of our ears, we've got two recesses. The first is at the base of the eardrum, and it's almost like a trench or a base, and we call that the inferior recess. So inferior means towards the floor, superior means towards the sky, anterior, where we are now, means to the front, posterior to the back. And then, so the first recess we typically have is an inferior recess, where there's a little trench at the floor of the ear canal adjacent to the eardrum, and then we can also get one anteriorly, so to the front part of the eardrum. And that's because as the ear canal travels towards the eardrum itself, it narrows around half a centimetre away, and then it widens again. So it protrudes back out, and that's what creates these recesses, these alcoves. Everyone's different though. I have seen some patients who don't have an anterior recess, but they've got a posterior recess, but typically it's to the front of the ear canal and to the base of the ear canal where we get these little dips and alcoves. So just going back in, I'm just using the fine end now, just for a bit more precision. It's less noisy, it's less traumatic. So if we do penetrate accidentally a bit deeper than we should up against the eardrum, it's less likely to cause any trauma or discomfort. So that's the eardrum hiding away behind these strands of hairs. So I'm just using the fine end, almost to try to glide these hairs off, because they are stuck at the moment, because they're quite sticky. As I mentioned right at the beginning of the video, not only is the earwax sticky, but the eardrum itself, the outer layer, it's made up of the same skin that lines the inner two-thirds of the ear canal, the epidermis layer. That in itself is also a bit sticky. So we're just trying to pull them apart. Going back to the home DIY methods of removing earwax, also another problem with water is you can sometimes accidentally, inadvertently flush the wax further into the ear. So the concept, when you're using water to flush out earwax, the concept is that you pump the water into the ear, it travels along the ear canal to the eardrum, and then the ear canal slowly fills up, and then the water makes its way back out, and as it's coming back out, it's flushing out any wax that you may have. So it can be an effective procedure. It's not to say that it's not, but there are more risks attached to ear. We don't call it syringing in the UK. Syringing is when you use a metal syringe at high pressure to flush it out. That's actually banned in the